Well, a Fishers-based startup says its medical device is ready for prime time. Recovery Force Health commercially launched its flagship product called the MAX system just days ago at a national healthcare convention. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you, Gary. The MAX system delivers what's called mechanical prophylaxis. These are intermittent compressions on the legs that increase blood flow to prevent clots after a surgery, for example. Any person that's been bedridden in the hospital will be familiar with traditional compression devices. They're cuffs worn under the knee, connected by hoses to a machine that powers them. Recovery Force says the MAX system is different and poised to disrupt the market with its modern version of this hospital staple. Recovery Force Health President Jason Bobay joins me now to tell us more. Welcome to the show.
Thank you for having me.
Congratulations on the product launch. I know this has been a long time coming. So let's just dive right in. Tell us, what is the MAX system and how is it so different than what folks are used to seeing in the hospital?
Sure. So the MAX system is a portable, non-pneumatic device that doesn't have cords or tubes like the standard of care does, and allows the patient to get up and move inside the hospital. Those other devices have been around for 30, 40 years with no innovation. So they were designed for bed rest, where ours was built for mobility.
And so let's talk about that mobility piece just a little bit more. It's a really big deal, a big feature of your product. And you said sometimes when people are in the hospital, they almost feel stuck in bed. So explain just a little bit more on the mobility piece of your product.
Yeah, you'd be surprised when you go to the hospital, 95% of a patient's day is often laying in bed. And that's something that we're trying to change and help the caregivers. So we give them the squeeze, the compression when they need it, when they are bedbound and can't get out of bed. And then when they are able to get out of bed, we're able to get them up a lot easier because our device tracks similar to a Fitbit, but for a healthcare patient. So it allows them to get up and get around a lot easier.
And I like how on the device you can actually see the feedback. The doctors and nurses can see it, but the patient can see on the device too how many steps they've taken, et cetera.
Yes, you can go into a patient's room without ever meeting them and tell them exactly what they've been up to over the last 24 to 48 hours. It's really neat.
All right, let's talk about this national convention you just got back from. It really, we had FDA approval about a year ago, so this was really kind of the big unveiling for your company. So tell us about the convention and why it was so important.
Yeah, this is our coming out party. It was exciting, and it was our commercial launch, and we did our alpha and beta testing for the last year. And what that did was allow us to optimize it and get it ready for a national scale. And so we went to Houston 2 weeks ago and had a phenomenal showing, tons of leads that we got out of it, and a lot of nurses trying on the device and really seeing what it's all about, because nobody knows who we are. So that's our ability to get out the brand and also about the product.
All right, and you're such a great Indiana story. Obviously, you're based here. You've been working with hospitals here to develop it and perfect it. You're manufacturing here. Talk a little bit just about the hospitals, that segment, and also manufacturing here.
Yeah, we're excited. I mean, it's right here in Indiana. Central Indiana is where we call home. We've grown our team by over 50% in the last couple of years, and intend to do that even more as we grow. And we're partnering with local hospitals. So IU Health just completed a great study design and had awesome results with our device, and looking to publish here in the near term. And then community hospitals looking to bring us on board as well, starting next month. So a lot of great things going on for the company.
And manufacturing right there in Noblesville as well,
Yes,
correct?
Absolutely. So we have our contract manufacturer in
I just
Fortville.
said Noblesville. It's actually
it's
Fishers, right?
It's Fishers, yeah, that's okay. We have some assembly in Fishers and then some contract manufacturing going on in Fortville. So all within 10 minutes away from each other.
All right, very good. And I like it. You said your target market is anyone in a hospital bed.
That's right. Anyone that goes to the hospital that's going to be bedbound for long term. Obviously, the critical care patient's a big deal for us, cardiovascular, neuro, and trauma. But any patient that's going to lay in bed over 95% of the day potentially is a candidate for our device.
All right, very good. Well, congratulations on the commercial launch, and keep us posted.
Thank you very much.